Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. I am Sugiarti. My affiliation is Pediatric Nursing Specialist Program, Universitas Indonesia. On this occasion, I would like to present my scientific study entitled Roy Adaptation Model Approach to Overcome the Risk of Attachment Disorder between Mother and Infant. Okay, just fine. What made me take a title in this study? This is due to the problem of the risk of attachment problem between mother and premature infant as a result of the separation between mother and infant during hospitalization. This problem also occurs because of the biological characteristic of premature infants, which causes the infant to need to be treated in an intensive care unit. The purpose of this presentation is to provide an overview of the application of Roy's 6-step nursing process and provide nursing care to premature infants with risk of attachment disorders, and the design used as a case study. The following is an integration scheme of the Roy adaptation models in nursing care of premature infants with the risk problem of the attachment disorder. As shown in the figure, the adaptation model consists of input, process, effector, and output. In this case study, I take 5 cases of premature infants which will be reviewed from a nursing perspective, which is through the 6 steps of the nursing process according to Roy model. The first step is behavioral assessment, which is studied in 2 adaptive modes. It is psychological and interdependent adaptive mode. And these rows show how the adaptation process occurs. And then the second step is the assessment to the stimuli. It is examining focal, contextual, residual, and stimuli from changes in behavior that arise, or describe the degree of adaptation of these stimuli. The next step is to determine a nursing diagnosis followed by goal settings. The problem that arises in these 5 infant respondents vary according to the baby condition. For example, ineffective breathing pattern problems, nutritional deficit problems, risk of ineffective thermoregulation, risk of infection, and others. The problem raised in this discussion of my study is the problem of the risk of attachment disorders between mother and premature infant, which of course is experienced by the 5 respondents in this case. The objectives set were to achieve increased attachment between mother and premature infants, such as verbalizing positive feeling from mother to infant, smiling, talking, eye contact, creation of mother-infant bonding, mother is able to feed or breastfeeding the infant, as well as the creation of attachment and correct position of breastfeeding. And then the 5th step of Roy's nursing process is intervention. One of the interventions undertaken to address the problem of the risk of attachment disorders is case studies through the implementation of developmental care. This is kangaroo mother care. In the practice of kangaroo mother care, besides being able to facilitate the attachment between mother and premature infant, there are so many research and studies that have proven its benefits. It is increasing infant weight, creating psychological stability in infants, and reducing maternal anxiety. Why is it so important to develop good attachment between mother and premature infant? This is because when the attachment occurs, the attachment hormone will stimulate the release of the hormone oxytocin, which is a chemical messenger for the formation of bonding or emotional bond between mother and infant. And why is this mother-infant bonding important too? According to Barker et al. 2017, this bonding can maintain systemic stability in infants. In addition, other benefits are also provided. They are reducing depression and anxiety in mothers, facilitate the formation of trust, love, protection, and the creation of prolonged breastfeeding. And then the sixth step, to evaluate the active response to implementation of care that has been carried out for 5 years of treatment. In this case study, it's known that most of the goals of care can be achieved or partially achieved, although it can also be said that it cannot be addressed as a whole. Based on the evaluation of the implementation of KNC using a vertical or upright position, it also turned out that efforts that are still needed to improve the quality of interaction between mother and premature infant. Why is that? Because the use of this vertical position doesn't support face-to-face and direct eye contact between mother and infant, so it feels that the interaction is not optimal. To answer this problem, and based on current evidence, a new kangaroo position called the support diagonal flexion was introduced, which is based on the primitive reflex of the newborn. It is the asymmetrical tonic neck reflex. The picture looks like this. Okay. At first glance, it looks like the mother is carrying her child. Well, how is the position of SDF done? The first, the infant is bare chest, face down with a diagonal position of mother chest. And second, the head is flexed toward the mother face, and it located between nipple and clavicle. And the third, the infant hands and feet are flexed, hip adduction flexion, and then the shoulder is adduction. Okay, and the fourth, fixation with a sling. And the last, the infant is in the same clothes with mother, like this in the picture. Okay, based on available evidence, this position can facilitate the creation of a contact and face-to-face contact between mother and premature infant. In addition, the position also supports the creation of vocalization, smiles, affective touch, and increasing bonding between mother and premature infant. So that is can support the improvement of the quality interaction between mother and premature infant, and of course will create better attachment. In the end, the kangaroo position of support diagonal flexion or SDF is also highly recommended as an alternative choice to be applied in the practice of implementing KNC. This is my explanation regarding the application of Freud's 6-step nursing process, which can be used as a framework in conducting nursing care to address the problem of the risk of attachment disorder in mother and premature infants. Thank you for your attention. May be beneficial for all of us. Billahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.